Welcome to the Eat Away Kidney Stones podcast. I'm your host, registered dietitian and kidney stone expert, Melanie Betts. After learning a ton about kidney stones and helping people prevent stones at the University of Chicago, I was fed up with all the terrible advice people were finding online. So I decided to do something about it. The Kidney Dietitian was born. This podcast is for people who want to learn what actually works to prevent kidney stones and still enjoy life, eating, and their favorite foods. Let's dive in. Hello and welcome to the 115th episode of the Eat Away Kidney Stones podcast. I am your host, registered dietitian and kidney stone expert, Melanie Betts. And today we are going to get a little bit into the weeds here and talk about thyroid disease and kidney stones, specifically parathyroid disease and kidney stones. I actually got this question from Jessie, a listener of the podcast, so let's listen in.
Hi Melanie, my name is Jessie. I recently became a fan of your podcast after undergoing my second kidney stone removal procedure. Along with chronic kidney stones, I also am diagnosed with Hashimoto's hyperparathyroidism. And so I guess my question is there a link between the two conditions, or are they totally separate?
Thank you, Jessie, so much for that question. This question definitely brought up, sort of pushed me to do this episode about thyroid disease in general and kidney stones, which is probably much overdue and a topic that I probably should put more content out there about. So thank you so much for that question. I definitely get a lot of questions about this, and I've absolutely worked with many people who have kidney stones and also specifically primary hyperparathyroidism. And so this is a really important episode. So let's go ahead and dive in. So first I want to kind of clear up this a little bit of confusion that I've already sort of teased here, and that there is a big difference between your thyroid, which lives kind of in your neck area, as well as your parathyroid. Your thyroid is certainly important, and it produces thyroid hormone that is all sorts of stuff. It really controls your metabolism, energy. It also has impacts on your heart, gut, and muscle function, and all sorts of different things. So thyroid disease is very common, both hyper, so high levels of thyroid hormones, and hypo levels of thyroid hormones. And that's a common condition. However, there isn't, as far as I'm aware, a direct connection between thyroid disease and kidney stones, at least directly. Okay, so that's everything thyroid. Now let's shift gears a little bit and talk about the parathyroid. And I feel like that oftentimes gets confusing, but there are two completely separate organs. So the parathyroid are four little glands that live kind of like right behind your thyroid, again, in your neck area. And the parathyroid glands do very, very different things than what your thyroid does. So the main thing that your parathyroid does is make a hormone called, unsurprisingly, parathyroid hormone, or PTH. And the role of PTH is essentially to manage bone metabolism and calcium levels, and also vitamin D and phosphorus levels, but most notably calcium levels. So this is kind of fascinating to think about, I think, but your bones are not these like sort of rocks that are holding you up. They're actually like metabolic organs that are constantly doing all sorts of things. They're constantly breaking down bone cells and building bone cells, and there's this sort of constant bone turnover happening to keep your bones healthy, which is really cool to think about, right? Kind of crazy, but cool to think about. And we get in trouble when our bones are not turning over the way that they should. So, that turnover is too slow, or that turnover gets too high. We really need it to be at this sort of right range of turnover for our bones to be healthy. And because PTH, or that parathyroid hormone, is so important in maintaining levels of calcium in our blood, when things get out of whack with that, it's unsurprising that calcium kind of goes crazy, which then relates to kidney stones. So let's break it down a little bit better than that. So again, the PTH is responsible for basically keeping blood levels of calcium where we want them to. It's going to signal to the bones like, hey bones, we need more calcium in our blood. So their bones are going to be like, okay, I'm going to put more calcium into our blood. And it also does, of course, other things to help make that happen. But essentially that's what this PTH is doing. And so when, for whatever reason, we have very high levels of PTH floating around our body, our parathyroid gland is kind of working in overtime, and we have these really high PTH levels, this all kind of gets out of whack, and we end up having way too much calcium released from our bone, which ends up in our blood, which isn't great. And then our kidneys are like, oh gosh, like we've got to get rid of this calcium, right? Because that's what our kidneys do. They do lots of things, biased, lots of really cool things. But one of the main roles of our kidneys is they are filtering our blood all the time and getting rid of whatever our body doesn't need in our urine. And so when we have these really high levels of calcium in our blood from these high PTH levels, our kidneys are like, oh gosh, we got to get rid of this. And so it dumps all of that extra calcium into your urine, which is great for blood levels of calcium in theory, right? Hopefully that's going to at least help temper the amount of calcium that's in your blood when this is happening. However, all of this extra calcium in our urine, of course, ends up giving us kidney stones. So in a nutshell, that's kind of that connection between hyperparathyroidism and kidney stones. And when we look at how this all kind of plays out in a clinical setting, it really, there really is a huge connection between hyperparathyroidism and kidney stones. There's two different types of hyperparathyroidism. One is called secondary, that's basically just related to chronic kidney disease. I'm not going to talk about that today because primary hyperparathyroidism is really the one that's associated with kidney stones, and it's really quite common. It occurs in 1 to 500 to 1,000-ish people, and this is really the one, like I said, that is associated with kidney stones. And the good thing is that if you discover that you have primary hyperparathyroidism, was actually from kidney stones, which is actually quite common. In fact, oftentimes patients present with kidney stones, like that's sort of their first symptom that sort of signals to everyone like, oh gosh, something's wrong. We've got to then go check and see if something is wrong with the parathyroid gland. And an estimated like 50-ish% of people who have primary hyperthyroidism will have kidney stones. So there's definitely a very strong connection between these two conditions. However, one good thing, I mean, it's obviously never good to have a health condition, right? But one sort of good thing about discovering that you have primary hyperthyroidism, and that's what's causing your kidney stones, is that the treatment for it is really relatively easy and quite effective. And most of the time, once we get the hyperparathyroid levels or PTH levels controlled, that essentially gets rid of your risk of kidney stones. So that's really a good thing. And the two treatments that exist for hyperparathyroidism is one, surgery. So basically the surgeon is going to go in and usually remove just a part of one of your thyroid glands, sometimes all of them, but typically just a part or one of them, because again, there's 4 of them, to help reduce how much of that PTH level is floating around and getting produced, which then, of course, once we get that under control, then the calcium is all going to fall into the levels that it's supposed to, which in turn is going to help reduce your risk of kidney stones, because hopefully urine calcium is going to come down. The other way that it's treated is through medication, something called a calcimimetic, which basically tricks your parathyroid glands into making less of that PTH level. So again, it really is kind of a weird silver lining to discover that you have primary hyperthyroidism, because it's an easy fix, right? It's something that's very treatable, and once we fix it, then typically that risk of kidney stones goes down quite significantly. I also want to stress that this is one of the huge reasons why I advocate for 24-hour urine tests so heavily. I know I talk about them endlessly, and you are probably so sick of hearing me talk about them, but I cannot say it more, because without this test, we truly have no idea what we can do to prevent kidney stones, and whatever steps we take to prevent kidney stones, we're really truly just guessing. And unfortunately, despite that, only about 20% of people will receive at least even one urine test in their entire life if they have kidney stones, and it should be done annually. But I digress. So yes, that is why I typically talk about 24-hour urine tests, and they're so important to help us really come up with a personalized, targeted, effective plan to prevent kidney stones for you. But the other reason that they're so important is because they can show us when something is going wrong, right? People don't just make kidney stones. Bodies don't just make kidney stones. There is something going on that is causing those stones, and sometimes it is another condition. And if people are having calcium stone after calcium stone, stone and we never get that urine test, that would never signal to your care team to be like, oh gosh, we better check PTH levels. We better check to see if this person has primary hyperparathyroidism. Because like I mentioned, a lot of times kidney stones are what is how patients present, is how we say it with primary hyperparathyroidism. It's really the first sign that something is off, is that you're having these kidney stones all the time. And so, unfortunately, so often we're not getting urine tests. And so we don't see that urine calcium levels are super, super high, which then, of course, would signal to a read doctor that we should then check for primary hyperthyroidism. I do want to sort of caution you, so I talk a lot about how high levels of calcium in the urine are the most common cause of kidney stones, and that's definitely true. So just because you have high levels of calcium in your urine certainly does not mean that you have issues with your parathyroid gland. But if you see that your urine calcium is super high, I'm talking, I don't know if there's an official cutoff here, but I'm going to say more than, say, 300 milligrams of calcium per day on a 24-hour urine test. That definitely would signal to me to be like, hey, doctor, maybe we should check a PTH level to make sure this isn't really what's driving this calcium imbalance in this patient, right? And so, yes, if you have high calcium, if you have, say 250 or something milligrams per day, that's kind of normal for someone with kidney stones. But if we start to see numbers in the 300s, 500s, that definitely is a sign. Like we should definitely be checking to make sure there's not something going on. And 24-hour urine tests can reveal other things too. It can reveal things like bowel diseases and other hormone disorders, other kidney problems. And that's why it's so important to be getting that testing, because it's really, it's not fun to collect your pee for a day. I get it, but it's relatively easy in terms of medical testing, right? And it can show us so much, not only about what we can do to prevent kidney stones, but also that, that there's something else going on. Because again, people don't just make kidney stones. There's something going on. We have to figure out what exactly is causing your stones. Of course, I'm a kidney stone dietitian, so I have to mention that diet and lifestyle still matters. Even if hyperparathyroidism is going on, even that is what's causing your stones, diet and lifestyle still matter. I will say that drinking water, unsurprisingly, is going to be your best friend here, especially before you get that treatment. We still want to make sure that we're doing everything possible to prevent stones during that time, right? Because stones can form, honestly, no one knows exactly how quickly stones can form, but stones can form in the couple months, certainly, that it might take for you to work through the medical system and get the treatment for that hyperparathyroidism, whatever it might be. And so, so drinking plenty of water, again, I always say that recommendation of 100 fluid ounces per day. All fluid counts to really help dilute that urine, right? We know that your urine calcium is super high when you have primary hyperthyroidism, but we can drink a ton of water to help dilute that calcium to reduce the chance that it's going to form a kidney stone. And then, of course, we can do all the other things that we typically do to help keep urine calcium levels down, and that is making sure that we're not eating too much salt, making sure we're not eating too much added sugar, and also not too much non-dairy animal protein. All of these things help sort of temper how much calcium is in your urine. Now, I definitely want to stress that these things alone, if you have primary hyperthyroidism, are not going to bring urine calcium levels down to normal. Diet is definitely not enough. We need that medical treatment desperately to help get those urine calcium levels down. However, if you have primary hyperparathyroidism and you also are eating a ton of salt, a ton of protein, a ton of sugar, these things are going to make that urine calcium even worse. It's going to make that urine calcium even higher than it has to be, likely. And so therefore even like sort of exacerbating that very high risk of kidney stones. So again, I'm biased, I'm a dietitian, but I think it makes a whole lot of sense to make sure you're doing all of those things to help at least keep that urine calcium down as much as possible. And then once you have that treatment in place, you've got your PTH levels under control, ideally we'll get another 24-hour urine test to assess what your risk of stones is. And like I said, most of the time we go back to normal and we're good and you can go on your life and not need to worry about it anymore. But we want to make sure that's the case. That's not always the case, right? And so we really want to be getting that urine test after treatment has been done to see where that urine calcium is falling, and also to assess other things. There might be other things that are sort of putting you at risk, and I imagine once you've had a stone, you might be very interested in what you can do to help reduce that risk completely, right? From all aspects. And so wanting to make sure, of course, that you're drinking your water and you're getting your calcium and whatever the things are, right? That's really really key. I wanted to really put a push in there, put a plug in there for the importance of nutrition and kidney stones, even when you have primary hyperthyroidism, because of course in this case diet didn't cause stones. It's very clearly the primary hyperparathyroidism that caused stones. However, diet can absolutely be an important part of your treatment and preventing stones, especially before you get treatment, to help sort of mitigate that risk and not make it even worse, right? If that makes sense. So before we end here, I wanted to kind of circle back to Jesse's question about specifically Hashimoto's hypothyroiditis, and also all of the other many thyroid conditions out there other than primary hyperparathyroidism. And as far as I'm aware, there's not data that's directly or a reason why these conditions would be directly impact kidney stones. However, knowing what we know about thyroid hormones and how they impact everything, there's definitely a concern that potentially if we sort of overtreat, especially a hypoparathyroid or hypothyroid condition, potentially that could have an impact on how your body is handling that calcium, how your kidneys specifically are handling that calcium and urine calcium levels, and therefore kidney stone risk. And so there, Jesse, this is a very vague answer. So the answer is potentially, maybe, there could be a connection, but maybe not. We'd really have to really dive into why you were forming stones, what your urine is looking like now, to see if that would also help us have some idea of if once that is treated, if urine calcium is still high, if that was still related. And right, we kind of have to look at the big picture to see what's really going on. But in general, when we think of thyroid disease, if you will, and kidney stones, it really comes down to that parathyroid, and specifically primary hyperparathyroidism, that is going to be most closely associated with kidney stones. With that, I will end this episode of the podcast. It's short and sweet, but I think it's a very common question that people ask about. Like I said, of course, because primary hyperthyroidism is so common and it's so highly associated with stones, I see many people who are sort of managing both conditions. So I wanted to kind of walk you through exactly what that connection is and help you understand a little bit how nutrition might fit into your care plan for the treatment of both kidney stones and primary hyperparathyroidism. So as always, thank you so much for joining me on the podcast. I look forward to seeing you again next Wednesday. If you have a question that you would like me to answer on the podcast, I would love to hear from you. You can just head to kidneystonepodcast.com to record your question for a chance to get answered on the podcast. And I hope you have a wonderful day and talk to you next Wednesday.
Thank you for listening to today's episode. For more help with kidney stones, check out my website, www.thekidneydietitian.org. For more personalized help from me, check out my online course, Kidney Stone Nutrition School. VIP enrollment includes help directly from me. I can't wait to see you there and help you prevent kidney stones. Have a great day.